So my talk was indeed about what are the challenges and the promises in autism research, the things that we found the most exciting in research over the last few years. And indeed, one of the challenges that we have when we do research in autism is that there is a huge heterogeneity in really the symptoms of autism. So there is a large heterogeneity in, for instance, the language development. Some children are nonverbal, some of them, they learn 10 languages. There is also a huge heterogeneity in their social skills and in the type of the restricted interest that they show or the repetitive behavior that they are showing. And so when you have such a complex disorder, one of the questions is first, like, is there any subgroups in that? And what we've shown over the last few years is that indeed there is more a continuum. So even for the clinical definition, we remove those subgroups such as Asperger to merge all of the different autism subgroups in one single category, which is autism spectrum disorder. So already at that level, we basically recognize that there is a huge heterogeneity in the symptom and in all the classes that you can find in autism. And then based on that, if you want to do research, then you're really faced with this heterogeneity. And how do you do when you have such a kind of a moving concept? And what people will do over the last few years is indeed focusing on things that were the most specific to autism that you can identify in all those children and also not in other children. So it's really something that is specific plus that you can observe in all the children. And what we've learned is indeed that what you can find in most of those children is the deficit in the social skills. So they really have difficulties in the social interaction, in understanding what is happening in the social plot, in orienting to other, and in really developing means of communication, so language, but also nonverbal communication. That's something that is much more specific to autism than any of the other symptoms, which are, for instance, sensory issues or repetitive behavior or restricted interest, which are things that you can also find in other diagnoses in child psychiatry. So people have focused on that, and they have developed also this idea that one of the things that might lack in the children who are affected with autism is the orienting toward the social stimuli. So the idea being that at the very beginning, there is something that they don't look at other people, they don't orient to other people, and then because of that, they don't learn from other people, so they don't learn things such as academic skills, reading, talking, or they learn in a different manner, but also they don't learn all the subtleties of the social interaction. So because of this lack of orienting, then there is a cascading effect that really affects a lot of their development. And this is what we call the social motivation hypothesis. And what I feel is very elegant with this hypothesis is that it really led to the development of therapies, such as, for instance, the early start Denver model, whereby you have a lot of hours during the week of a child, 20 hours of intervention, where you really teach them those social skills. You try to reinterest them in the social aspects, initiate their interaction to request things that they like and that they want. And so the really nice thing with the social motivation hypothesis is that basically then we have a therapy that goes along with it. And in research over the last decade, there was a lot of interest into quantifying all those aspects. So for instance, people used a lot of eye tracking paradigms where you can quantify very precisely if you look at faces, if you look at eyes, when you follow a social plot, a small interaction, what people are really getting from this interaction depending what they are looking at. So there's been a lot of that in the research over the last few years. But what I think is really interesting is that we saw that these social interactions are difficult for those children. They don't really get all the subtle social cues. For instance, following the attention of someone on an object, something that we call responding to joint attention, so basically focusing on the same thing. There are a lot of things like that that can be affected in children that are on the spectrum. But interestingly, the orientation to the people is something that is not affected in the first months of life. So it's something that despite the fact that they are born with a predisposition to develop autism, the first few months of life, until 4 or 5 months, they will look at other people in the eye, and it's after only that they disengage and they find that the interaction is not as rewarding as children that are not on the spectrum. So that's something that also research is now struggling with, identifying what are the very early predictors of autism so that we can intervene earlier, because we know that the prognosis is really bound to how early and how intense we intervene with those children. So something where we would like to identify what are the very early predictors and why is there that children that will develop autism, they look into the eyes over the very first few months of life and then they disinterest, more or less they disengage, and they focus more on object and less on the social cues. There are a few interesting hypotheses that are going to explore that. So for instance, the hypothesis of sticky attention, so that you look at something and you cannot really disengage your attention. You keep looking at that without being able to switch and look at something else, reorient your focus of attention on something else. And that's something that might explain why children have difficulties in the social interactions. Because if you imagine a social interaction, something which is very subtle, very complex, fast-paced, so you need to really reorient your attention all the time in order to be able to follow that. And maybe if you're not able to do that, then you probably lose interest in that because it's not as interesting, as rewarding to follow that. So that might as well explain the social interaction difficulties in the spectrum. And the beauty of this hypothesis is that we could also explain the repetitive behavior. Because if you're always focused on the same thing, insist on the same thing, because you just have a sticky attention, then it might also explain why you develop restricted interest. So it doesn't only explain the social symptoms, but it might also explain the other kind of symptoms that we find in autism. So basically, just to sum up, what I find interesting in the research over the last decades is that it's really looking into more subtle, more complex mechanism about why a child will develop autism, going into the earlier mechanism also, identifying really the earlier predictor of autism so that we can intervene early. And there is no doubt that this research, which is really at an increasing pace, so we have new studies coming every year. Just last year we had 4,500 studies coming out with the keyword autism. So it's really an exponential increase in the pace of the autism research. And I have no doubt that this will, at the end, ultimately be translated into the clinical practice and change the way that we care for those children affected.